Hello, everyone. It is a pleasure to open this webinar as we have amazing speakers from our community joining us today. And we are going to talk about advocacy. In rare diseases, this is a very important subject, and we all know how many challenges we have, starting with access to early diagnosis, early treatment, access to specialists, to appropriate care, and of course, management of the disease. Sometimes it's about advocating to change policies, to change mindset. Sometimes it's just about getting through the day, fighting to get the right services for you, your child, your patients. Today, we have with us Andre from Lithuania. She is a mother of a child with Gaucher disease type 3. We have Dr. Imalke from Sri Lanka, a doctor who is doing miracles to improve the life of rare diseases in Sri Lanka. We also have Roselyn from Kenya. She's a mother of a rare disease child, a patient advocate, and I have to say she's one of the leaders in rare disease Kenya. We have Alexandra from Peru. She is an advocate who never gives up in changing policies. And I'm very happy to be part of this exceptional group of people. So advocacy can be many things, as I said, but do not forget that the main things that connects everything is about communicating the facts, the statistics, the stories, the information, all of it matters. And you have to surround yourself with people who will support you and support your cause, and people who will share perspectives and ideas to go forward. So you don't need people who will tell you, this is not possible, we can't do this. You need people who will say, okay, let's see how to do this. Maybe it seems impossible at the moment, but the next step is to see what kind of opportunities this challenge is hiding for us. We have to be hopeful for the future. Otherwise, why advocate? Um, of course, we have to remember that advocacy is different in different countries, but that doesn't mean that we cannot learn from each other. This is why in this webinar we have people from different parts of the world, because you can see that sometimes maybe you are not going to do the same thing in your country, but you can do something similar, adapted to your situation. Use the idea. And sometimes it's just about getting inspiration from other people. You think, okay, these people did this here, we can do something else in our country. So just like for comparison, you have North America and you have Europe. So North America and Europe have patients on the table. They are involved in decision making, in clinical trials, in treatment improvement, in health technology assessment. They go through different training courses. They have, and this is how they can bring more to the patient experience. They network. They try to stay at the top of their game, and this is. Trust me, this is not easy. Being a patient advocate, at the end, it becomes a full-time job, although for most of us it's something that we do as volunteers, something that we do in our free time, and it's really not easy. So the thing that we can learn is actually that we have to be visible, we have to be brave, and this is how we are making changes to for better quality of life. I also put a slide for Africa, but I'm not going to talk about it because I know that Roselyn will talk about this in more details. But I have to say that I'm proud of what Roselyn and her group in Africa had achieved up until now, especially with the family meetings they organized, empowering patients and caregivers. So what I need you to remember before we start with the other speakers is that your voice matters and you have to be loud. You have to speak your mind and drive the future into direction that is best for you, for your community. So now I would like to invite our guests, and I'm going to start with Roselyn. And Roselyn is going to speak more about what's going on in Africa. I'm just gonna say that, like, I'm very happy to know her because she's one of the people who is doing a lot with very little.
Thank you, Vesna. Thank you for that. And it's a pleasure to be here. I hope you can all hear me. Just put a thumbs up if you can hear me. Um, I'd like to give a bit of a background about myself, given the topic of the day. So I'm a mother to a child with a rare disease, though not Gaucher. My child has what is called Gaucher syndrome, and my journey started 9 years ago. And borrowing from my experience where we had difficulty in just navigating just the early months and early years of constantly going to the doctors and the costs involved because we had to take extra insurances, and even then you still had out of pocket. We had a bit of misdiagnosis, but it didn't really impact us in that way. Of course, there's the emotional burden that you have to deal with. I have to stop kind of working. I was working from home, and even then it really affected, like I had a business that was going on, and all this affected, of course it affects life, and it affects the family unit. And so there's also the living with uncertainty and to some extent also isolation, because you don't know the prognosis of your child. You're in unknown territory every time you meet the doctors. You kind of have to sometimes be the one to explain to them what is going on. And there was just no rare disease space for other people. Like you constantly feel alone, and people constantly don't quite understand. Our challenges are unique. There's a lack of treatment for most of these conditions, and there's just lack of awareness in the doctors. So I decided maybe it's about time we did something about this. So together with a friend, Christine Mutena, we formed Rare Disorders Kenya. And we just wanted initially we're just celebrating rare diseases every February. And then in time, we said maybe it's time we did more than that, because our stories were sort of replicated in a lot of people. The same challenges, misdiagnosis, lack of treatment, the challenges that most people living with rare diseases that you might know. It was almost the same. It was just different people, but the same script. And so we sought out to build a community for families and for people living with rare diseases in Kenya. And so before I get into my work with IGA, I'd like to just mention a bit about Rare Disorders Kenya. And so we are a national rare disease organization, and we bring awareness to rare diseases in the country. And for me, it started by sharing my journey initially, and you have to be vulnerable in the society to just tell your story. And in a society where stigma can be high, that sometimes can be difficult because people might not understand, or people have certain misgivings about having a disease or what caused the disease. And I'd like to say at this point that the importance of sharing your story, it empowers others, and it gives hope, and it can drive change in ways that you probably would not have imagined initially. You're able to influence policies, you're able to humanize what you're going through, the face of rare diseases in whatever spaces you are, and even change practices and mindsets that people might be holding into. And by them listening to your story, at least you give someone else a voice to be able to tell their story. So for us, we wanted to have a community that people could be supported. And so we have one of the most diverse support group for rare diseases in the country, with over 150 people, and it's growing day by day. And we get support from doctors who refer patients and families to us. And just fighting for positive and lasting impact in the country is something amazing that you see every day that's happening. And so for us, we've been pushing for inclusion for rare diseases in the healthcare system. We're right now pushing for guidelines to be written for rare diseases, and we hope within the next 1 year, Kenya will have a guideline on rare diseases. We've been partnering with the Ministry of Health, among other areas. We've gained quite a bit of milestone. But I'd like to change gears now and talk about my work with IGA. Uh, uh, I am a Gaucher Connect leader for Africa, and based on my experience as a co-founder in Rare Disorders Kenya, I wanted to just sort of make a difference for the Gaucher community, because rare diseases, Gaucher disease is one of the diseases that has treatment, and yet doctors don't know about it sometimes, or even know how to manage it, or even families don't have a place to or connect with others. And so for me, I wanted to start with the basic, the rare disease, one rare disease that has quite a bit, I must say, of uh, research that has been done, and there's a lot going for it, and there's hope, not that the others don't have, but that there's a lot that we could learn from in terms of even in my experience, owing to the fact that I had no experience in advocacy where I was coming from. And so for me, it was just to bring awareness to the community and in the Kenya and in the region, and pushing for also stories in the media, telling people, just telling their stories, and other people meeting other people who have children like them, and empowering just caregivers and patients with information in terms of what does it really mean. Sometimes you meet families that they have a diagnosis, but they don't really understand what does it really mean, what causes it, because maybe the doctors didn't really take time. And so for me, my work involves continuing to build safe spaces for the Gaucher community in Africa. We currently have a support group in Africa that we have people from different countries. Right now, we have over, I believe, 7 countries in it, that people, whenever we have people who have Gaucher in the community that we become known to us, we join them, and they have a place that they can talk and, express their fears and their things that they'd like to talk about, anything to do with Gaucher. Recently, we hosted the Africa Gaucher Family Conference last year. It's the second time running, and it was an opportunity for people to meet from different parts of Africa again in person. And it was an amazing time for families just to meet and encourage each other. And this last year was the first time. It was six different countries, and I hope that we'll continue growing every year. My work also involves engaging and helping healthcare providers support the community in terms of even managing the condition, getting information, connecting them with experts, and also just telling them about the access program that is available. Sometimes also it means that connecting with doctors in continuous medical education forums and telling them about Gaucher disease and what they need to look out for, or who they need to talk to in case, because sometimes you have doctors who are more experienced in managing Gaucher in the country. I must say the awareness is growing. There's more recognition about Gaucher in Kenya and Africa also, but still a lot needs to be done. There's still misdiagnosis. There's still families that are struggling, despite even getting the diagnosis. They still need to be able to go to the health centers, and sometimes they need to travel long distances just to do that every 2 weeks. And so a lot needs to be done, and it's being done, but at least there's hope. And so for me, I'd like to end with the fact that for me, I don't see hope as a passive thing. It is something that we all need to build together, and we all need to put it into action. Each early diagnosis, each trained doctor, each supported family builds hope. It's like building blocks to a house. And in Kenya, we have a saying that says, kidole kimoja hakivunji chawa, which means one finger cannot kill a louse. And so advocacy, diagnosis, and care in Gaucher disease requires the collective effort of each and every one of us in whatever space you are, whether you're a patient, your family, in whatever space, we can all make a difference by small actions that we put together. Thank you.
Thank you, Roselyn. That was very nice. I love hearing about your work, and you're an amazing mother, first of all, and then you're a mother to a lot of other people, which is even more difficult. And I know that a lot of patient advocates are doing exactly that. They're being a mother or a father, a caregiver to many other patients, other families, because this is how we support each other, how we try to manage the difficult health systems and the difficult policies and governments. something that we want to improve, to have a better life, to actually have a little bit more of a normal life than usual. Okay, now from the world in Africa, we are going to Sri Lanka and Dr. Imalke, and I'm sure that he will share something quite interesting from there, as we are working together uh, for a long time now, and we are doing things, and not just IGA together with Dr. Imalke, but also there are a lot of other organizations supporting and trying to do our best to make changes. Go ahead, Dr. Imalke.
Right. Thank you, Vesna. Can you see my slides?
Yes.
Yes. Okay. At the outset, thank you for selecting me for this important meeting. So I'm going to discuss not only the Gaucher, what is happening in Sri Lanka. So I'll start my talk with a little bit of a background about Sri Lanka and who I am and what is the situation of metabolic disorders in Sri Lanka and the metabolic support Sri Lanka and Gaucher disease, their issues and the current situation. So Sri Lanka is called as Pearl of the Indian Ocean, which is located just underneath India, which is a small island and 22 million population. And Sri Lanka is popular because of its tourist attractions, and in 2025, it was named as the world most beautiful island by one of the tour agents. And so this is where I am from. I am from Galle, which is a southern part of Sri Lanka. And with that background, I would like to start with the economy of Sri Lanka because it's everything based on the economy. So if you look at us, our GDP is around 4,000 US dollars per year. But compared to the economy, our health system is somewhat developed compared to the other same countries with the same economy. We have free healthcare for all citizens. They don't need any insurance. But there's a parallel private sector. Those who want to go to private sectors, they can always go there. And we have government medical faculties, no private medical schools, and all our specialists should undergo mandatory training in the UK, Australia, or New Zealand in a developed country. And most of our postgraduate degrees are recognized by the UK. So compared to the economy, the health system is developed, and you can see it with these figures. So the neonatal mortality in Sri Lanka is about 7 per thousand, oh, maybe 5 to 6 per thousand, which means every 1,000 newborns, 6 babies are dying in Sri Lanka. But whereas in the Asian figure is somewhere around 12, 13, African figure is in between 20 to 30. We are, although a developing country, our statistics are more towards the developed countries. And even child mortality wise, you can see we are at a green zone. But unfortunately, even though the big picture is like that, the metabolic disorders are not getting that standard of care. But one thing I must say, all our pediatricians are very good at suspecting these diseases as well as diagnosing because they have been trained in another country for at least 2 years. But having said that, we don't have enough investigations, and we don't have treatment, and we don't have metabolic pediatricians. And also, our disease pattern is different to what I have seen in the West. And we have cousin marriages, around 7% of our marriages are between families. So, therefore, we see quite, although rare, but we see a significant number of patients in Sri Lanka with metabolic disorders. Now, with this background, what I did was, so I did my training in Oxford actually to become a consultant pediatrician, and then I went back to UK to spend 13 months in this place, Royal Manchester Children's Hospital, where I got specialized in inherited metabolic disorders, and I am the only pediatrician in Sri Lanka at the moment with this kind of a training. And then afterwards I had some short courses as well to get myself trained in this field. And it is not that easy to establish something which is not here at the moment. After I returned from the UK, I connected with some teams while I was in the UK. That was in 2022 to 2023, and I met this lovely team, Metabolic Support UK, in London, and then I have been closely working with them for last 3 years. And one success story is that I joined their Think Ammonia campaign, and through that I managed to raise some funds to get ammonia analyzer for my hospital. That is the only ammonia testing available for the entire southern province in Sri Lanka at the moment. And also I am connected with International Gaucher Alliance. We have done few capacity building webinars, as well as I am connected with them to get enzyme replacement therapy for children with Gaucher disease. We have had one success story in it. And also IGA and MSUK both helped us to build a rare disease registry. So this was kind of supported by a US company called Symmetry ML. We have had series of meetings, and even we are meeting once in every 2 to 3 months at the moment, and getting sharing our progress. And so this is the registry I am having at the moment. Nearly 50 children with inherited metabolic disorders have been entered into this registry, and through this registry our plan is to get connected with the rest of the world in terms of the treatment, advocacy, as well as sometimes for experimental trials as well. And not only that, I am getting support from the Manchester metabolic team, where I got myself trained, and we are having meetings, MDT meetings, whenever I need help. We used to contact with them. And regional teams are very important. This lovely person, Dr. Anil Jalan from India, he used to come at least twice a year to see our children with inherited metabolic disorders free of charge. And he is taking some of our samples and getting done in his laboratory free of charge, which I must thank him for the great service he is doing at the moment for us. And some of these works were identified in the Rare Revolution magazine in 2024. And I thought to share it at this moment. And also I was awarded as the Young Asian Investigator Award in Japan recently. And it is not easy to do plan things as the only person, but I get some support from the Asia Congress of Inherited Metabolic Disorders, especially from Japan and Malaysia, Thailand, and Philippines. So some of them are going to come in 3 months' time to Sri Lanka to have joined our next Asia Pacific Pediatric Congress as well. So two success stories I would like to mention. With the involvement of International Gaucher Alliance, we managed to secure ERT for one child with Gaucher disease who was about to go ahead with a bone marrow transplantation with the help of Manchester metabolic team. And another child with mucopolysaccharidosis, we managed to secure enzyme replacement therapy for only for 2 years at the moment, but we are planning to extend it further. So we are slowly moving up. And with that background, a few weeks ago, we initiated this project called Metabolic Support Sri Lanka in collaboration with Metabolic Support UK. So we invited families, parents, media, health ministry officials, WHO representatives to one of the main hospitals in main city in Sri Lanka, and we launched this program. It is not only a patient support group, but it is kind of a clinician support group as well. So we went to media recently. We have been in news and other health meetings in medias, electronic media as well as in paper. So we managed to publicize these rare conditions among the community, and now these conditions are known to the health ministry actually. But before these events, they were not that aware about this kind of patients in Sri Lanka. So our main objectives of creating Metabolic Support Sri Lanka was to create a peer network for patients and caregivers, and also to provide adequate information, dietary management and treatment. And also we wanted to collect the burden of these conditions to plan policies, and also we wanted to connect these families straight away to international organizations like International Gaucher Alliance, MPS Society, likewise. And this is the website, Metabolic Support Sri Lanka. This is a page allocated by the Metabolic Support UK, and in which you can get information for families, parents, as well as clinicians. We are still in the process of expanding the website. So some of the information are available in local languages, some are in English. So if I mention the situation of Gaucher disease in Sri Lanka, diagnosis is a problem, but our pediatricians are good at arriving at the diagnosis, or clinical suspicion, very good. Obviously diagnosis need in enzyme assays as well as genetic, which are not that available. But these four patients, actually one patient has already expired and 3 patients I am following up at the moment. None of them, first patient is Gaucher type 1, who received enzyme replacement therapy by the government of Sri Lanka for a period of 6 months before the COVID. But after the COVID and there was an economic crisis in the country, the cost of the medicine was not affordable for the government. Because of that, this first child massive liver and spleen at the moment. Other 2 children are we are in the process of applying for ERT, but it is not that easy with some of the legislations in the country. So that is the situation. And the diagnosis, we don't have proper diagnostic facilities in the country and no treatment as well. So we are planning to have further meeting on 5th of May. We have already secured a meeting with the Ministry of Health to create rare disease policy, and the Ministry of Health should come forward and create inherited metabolic disorders patient registry, and we need to expand for further collaborations. R&Ds are important, and also we should create metabolic pediatricians for Sri Lanka. And I would like to wind up at this point, and thank you very much. I hope we will see some light at the end of the tunnel, and I'm happy to answer if there are any questions. Thank you.
Thank you, Dr. Imalke. This is a great story of how, sometimes it's not, the patients can't always be proactive, and because there is a stigma, they are afraid, they don't have the knowledge. And it's good when sometimes the doctors are the ones supporting them and creating a network so the patients can be empowered and get their rights of treatment, management, and diagnosis. So thank you for sharing your story, and I hope it will inspire others. Now we are going to our next speaker, to Alexandra from
Gracias.
Peru.
Bueno, voy a compartir mi historia, que creo que es muchas historias que se repiten, ¿no? No es algo personal, sino es algo que se da mucho en muchos países, por lo que he podido escuchar. Bueno, el proceso aquí, como todos hablamos mucho de la odisea diagnóstica, en mi caso no fue diferente. El proceso del diagnóstico de enfermedad de Gaucher fue largo, ¿no? fue complejo de alguna manera. A lo largo de mi vida tuve sintomatología, ¿no? Eh, hemorragias nasales, agrandamiento de vaso e hígado, más adelante una dislocación de cadera, posteriormente en paralelo el sistema inmune disminuido, y finalmente tuve una osteomelitis en miembro inferior, lo que ya detonó las alarmas en cuanto a hacer una investigación más profunda sobre mi tema médico. En ese transcurso pasé por médicos especialistas como pediatría, como traumatología y otras especialidades, dándome como diagnóstico tentativo tumor abdominal, una leucemia o un cáncer de huesos. Finalmente, se solicitó una consulta externa a la especialidad de hematología, me hicieron los exámenes correspondientes, entre ellos un aspirado de médula ósea, cuyo resultado fue presencia de células Gaucher en médula. Y para confirmar este diagnóstico, finalmente me realizaron una prueba molecular, ¿no? Ya ahí, digamos, no teníamos la incertidumbre de qué enfermedad me estaba afectando. Posterior a ello viene el tema del acceso a tratamiento. Y ahí fue otra odisea. En un inicio el medicamento no se encontraba en Perú, no estaba disponible en Perú. Lo que recibí en este tiempo que no tenía el tratamiento fue un tratamiento paliativo con vitaminas B12 y todo el espectro de las vitaminas B, para de alguna manera sostener mi sistema inmune, pero todos sabemos que esto solo es un paliativo, finalmente la enfermedad sigue avanzando y seguía deteriorando mi sistema. Cuando llegó el medicamento a Perú, yo ya no tenía cobertura de salud al haber cumplido la mayoría de edad. Sin embargo, tuve en ese proceso, en ese interín de espera de años, estudié, me inserté al mundo laboral y por fin pude reiniciar una atención médica que me permitiría retomar mis temas, ponerme al día, ¿no? En cuanto a mi salud, ¿no? Y que en ese momento, al haber estado tantos años sin un tratamiento específico para Gaucher, me había deteriorado de tal manera que ingresé al hospital en crisis. Paralelo a ello, esto fue una carrera titánica en el sentido de, bueno, en Perú, no sé si en otros países, hay mucho tema de procesos, temas burocráticos que retrasan el acceso a tratamientos. Gracias a mi madre, con la persistencia que ella puso en que yo accediera al tratamiento, estuvo día tras día haciendo el seguimiento a los procesos, tocando puertas a las diferentes áreas que tiene un hospital, adquisición y logística, etcétera, hasta llegar a hablar con gerencia y demás, para que se me diera el tratamiento que ya se encontraba en Perú. También hay un compromiso por parte de mi médico tratante. Finalmente se logró el acceso, recibí el tratamiento y este esfuerzo que ambas hicieron, tanto mi madre como mi médico tratante, sirvió no solo para en ese momento darme el acceso al tratamiento, sino también abrir camino a otros pacientes que fueran diagnosticados y que por A o B motivo llegaran a ese hospital en donde yo me estaba atendiendo. Mi experiencia de todo lo vivido me hizo reflexionar en cuanto a no es todo un tema individual. Si bien es cierto yo conseguí el acceso, creería que esto lo debería replicar y fue una motivación y un compromiso para mí. APPEL para mí es una motivación en cuanto a representarlos, porque de tal manera yo tengo el compromiso frente a los pacientes en representarlos y apoyarlos en tema de vulneración de derechos y en otras muchas cosas más que voy a aplicar más adelante. En APPEL trabajamos para que cada paciente y familia se eduque, entienda la enfermedad, entienda todo lo que hay alrededor de, se empodere para que ellos mismos sean proactivos y activos en cuanto a no permitir que sus derechos se vulneren. Y estamos concientizados en que la defensa tiene que ver y está relacionada con la acción constante a través de la educación, a través de transformar realidades por un acceso a tratamiento o por un acceso a diagnóstico, visibilizar estas enfermedades lisosomales que son parte del espectro de las enfermedades raras. Eh, Sin embargo, la experiencia que he tenido a lo largo de estos años también, es claro que muchas veces las asociaciones o las sociedades no avanzamos por un tema de falta de compromiso de tomadores de decisiones, incluso por falta de voluntad política, ¿no? Que lo que hace es alargar el camino, llenarlo de burocracia y finalmente en este proceso de burocracias y papeleos y demás para poder lograr un acceso, los pacientes mueren, ¿no? APPEL tiene un compromiso con la comunidad lisosomal en Perú. Es una asociación sin fines de lucro, eh, legalmente constituida del 2007, impulsado por pacientes, familias con diagnóstico lisosomal. Tiene 19 años representando e integrando personas a nivel nacional, personas con diagnóstico lisosomal a nivel nacional. Y nuestra misión es mejorar la calidad de vida del paciente, promoviendo el acceso, el diagnóstico, la investigación y el tratamiento integral. Nuestros campos de acción, el soporte directo, orientación, acompañamiento, soporte integral, tanto que impactan directamente en el paciente e indirectamente en las familias. Educación, realizamos capacitaciones, webinarios sobre enfermedades lisosomales y raras para pacientes, familias, médicos, incluso líderes de asociaciones de pacientes de enfermedades raras. Hemos incursionado en el tema de incidencia política, realizamos actividades de políticas públicas en salud relacionadas a enfermedades raras y también nos enfocamos en concientización social a través de campañas online, presenciales, campañas de descarte de enfermedades raras, simposios, foros regionales para visibilizar las enfermedades lisosomales y raras, tanto a nivel nacional como internacional. Listo. ¿Qué es la defensa del paciente? Ya lo había mencionado Vesna inicialmente, se enfoca básicamente en asegurar que sus derechos y necesidades sean escuchados, representar y apoyar a los pacientes, convertir al paciente en un actor activo en su cuidado y en ámbitos de acción, de atención médica, procesos administrativos y políticas públicas. Como diríamos, en resumen, es una persona que da voz y representa a los pacientes ante una vulneración de derechos en salud. Esta persona generalmente es una persona comprometida, ¿no? Se convierte en un mediador clave entre el paciente y la institución de salud, el paciente y los tomadores de decisiones, el paciente y el Estado, y está en una constante formación continua que ayuda a que se desenvuelva en estos ámbitos. incluso hoy día que la persona que está a cargo de la defensa del paciente, digamos de alguna manera, es un paciente experto, incluso diría yo un cuidador experto. Experto en el sentido de la propia experiencia de todo lo transcurrido con el diagnóstico que se le haya brindado, todo el aprendizaje que ha tenido y ha ganado con el proceso para llegar al tratamiento, y finalmente esto lo masifica hacia otras personas quienes requieren ese apoyo y ese acompañamiento ante múltiples actores. Este rol impacta en la defensa del paciente en muchos sentidos, en defender el derecho a la salud, ser portavoz frente a instituciones, educar y en concientizar sobre enfermedades, apoyar emocionalmente. Muchas de estas diagnósticos de enfermedades raras y lisosomales afectan emocionalmente al paciente, incluso a la familia. Colaborar con profesionales de toda índole, sean médicos, y de psicólogos, nutricionistas, etcétera. La enfermedad Gaucher es una enfermedad abordada multidisciplinaria, y definitivamente promover acceso, el diagnóstico temprano y el tratamiento oportuno. La defensa del paciente es clave en tres aspectos, según mi entender. Transforma vidas. La defensa cambia de la experiencia de paciente en paciente. Aquí podemos apreciar algunas fotos de pacientes que les cambió la vida en cierto sentido. Aquí tenemos la paciente de los dos pequeños. Uno de ellos eh, estaba en silla de ruedas. Después de un proceso muy largo para lograr el acceso, se logró, y su vida dio un vuelco de 360 grados. Eh, Pudo volver a caminar por sí solo, sin el soporte de una silla de ruedas. Incluso a nivel comunicacional se desenvolvió de una manera distinta a la que estaba. Y ese tipo de situaciones o desencadenantes, al haber logrado el acceso, es gratificante, tanto para nosotros como asociación, como para la familia, al ver que una persona que estaba limitada en sus movimientos, es como que vuelve a nacer. En la otra foto de la derecha es una familia que hace pocos días se logró el acceso, tenía el acceso en un hospital pediátrico. Cosas de la vida, cosas de la estructura del sistema de salud, que lo mencionaré al final, hacen de que un paciente pierda la continuidad de tratamiento porque pasa de un hospital pediátrico a un hospital donde se atienden las personas que están mayores de edad. Entonces, ese interín de pasar de un hospital pediátrico a un hospital de adultos, se perdió la continuidad del tratamiento luego de mucho trámite, procesos burocráticos, eh, y mucha insistencia por parte del padre del paciente, de la asociación y de otros actores, incluyendo los médicos especialistas y demás, se logró el acceso. Fortalecer asociaciones, unimos esfuerzos entre organizaciones. Aquí en la foto de abajo son representantes de asociaciones de enfermedades raras que participamos en una campaña de descarte de enfermedades raras y charlas magistrales de las especialidades diversas. Esto fue en una región de Lima, Perú, perdón, una región del Perú, se llama Piura. Y finalmente la colaboración pública-privada. Trabajamos junto a industrias, Estado y sociedad civil. Creo que es un equipo claro, estableciendo sus límites. Se puede avanzar mucho más, ¿no? Aún en Perú estamos en esos procesos a nivel general, ¿no? Que el Estado trabaje junto con la industria, que las sociedad civil también, incluso hagan un match con el Estado. Nos falta mucho por mejorar en ese sentido, pero creo que es la única manera de que todo este tema de problemática que hay en cuanto a vacíos en el diagnóstico, tratamientos y demás, avance. Y en Perú tenemos instituciones en los cuales el paciente puede acudir para realizar procesos y mecanismos de defensas. Tenemos el Ministerio de Salud y Salud, tenemos el libro de reclamaciones para MINSA, que es el Ministerio de Salud, y para Salud tenemos lo que es la Defensoría del Asegurado. Ante la vulneración de cualquier derecho, pueden acudir a todas esas instituciones, iniciando desde aquí, Ministerio de Salud, Defensoría. Si esto, digamos que la queja o el reclamo o la denuncia incluso no fue atendida o no te satisface la respuesta que te dieron, acudes a la Superintendencia de Salud. Estos hacen su propio proceso. Luego, si no te convence o no estás de acuerdo con el resultado que te han brindado o en la respuesta, incluso no te hicieron caso a lo que tú estás reclamando, acudes a la Defensoría y finalmente, si aún así no logran proteger o reponer o resarcir de alguna manera tu derecho a la salud, puedes acudir al Poder Judicial. Incluso yo diría, si no te da un buen resultado o no se resuelve tu caso aquí, puedes acudir a la Corte Interamericana de Derechos Humanos. Y aquí está nuestro APPEL con los pacientes. Ambos acuden a esas instituciones y hacen un acompañamiento en cada uno de los procesos para, de alguna manera, resarcir o revertir la vulneración de derechos a servicios de salud. Y no solo podemos quedarnos en el acompañamiento y la defensa en cuanto a pacientes que han visto vulnerados sus derechos, sino también es importante hacer cambios, ¿no? Exigir cambios en las políticas públicas para que las estructuras del sistema de salud cambien, incluso mejoren. En Perú actualmente tenemos 4 puntos críticos, como es la actualización del umbral de alto costo. En este punto se define qué se considera un tratamiento de alto costo y qué no. El cumplimiento de la normativa en cuanto a la evaluación de tecnología sanitaria, que la norma dice que se debe realizar en 45 días. Actualmente nos encontramos con 9 meses de retrasos en la evaluación de una primera tecnología sanitaria. El punto 3, mecanismos de acceso, mecanismos de adquisiciones diferenciados, que son compras de medicamentos a nivel nacional. No se ha implementado nada en ese sentido para raras. Podría ayudar de alguna manera a través de negociaciones de dosis adicionales, descuentos, consumo, etcétera. Y ahí se podría hacer un avance en cuanto se involucre el MEF y MINSA. Esperemos que esto se dé, es algo, diría yo, casi prioritario. Y como punto 4, la actualización de la lista oficial de enfermedades raras. Esta se cambia o se actualiza cada 3 años y es de suma importancia porque asegura el reconocimiento de enfermedades raras, lo cual permite un acceso prioritario a compras de medicamentos para tratamientos existentes en Perú, incluso fuera con algunos mecanismos. Entonces, la solución a estos puntos requiere un esfuerzo combinado entre autoridades, industria y sociedad civil para transformar el panorama de enfermedades raras en el Perú. Como podemos ver en todo lo que he compartido con ustedes, la salud no empieza en el tratamiento, empieza con el diagnóstico temprano y el acceso oportuno. Juntos podemos construir un sistema de salud más justo, inclusivo y humano. Y aquí les quiero compartir una foto de la comunidad Gaucher en Perú, y un lema importante y que lo repetimos mucho en actividades es Tu voz importa. Cada historia que se cuenta abre un camino esperanzador y de acción. Muchas gracias por la atención.
Okay, great. Thank you, Jose, and thank you, Alexandra, for your beautiful story. I think every region, every country has its own difficulties. It's just sometimes they are similar, sometimes they are different, but there is always something to fight for. From what I can see, as I do have communication with many countries, I do realize that access to early diagnosis, access to treatment, to getting the treatment early, and access to the right doctor to manage your disease is not an easy thing to do in any country in the world. So that's something we all need to do together to fight for a better world, because this is what we want for our children, of course. Maybe for us it's too late, but for our children it's not. Step by step. And now, at the end, we have Andra. She's not at the end because she's less important, but she's very important for us. She's a board member at the IGA, and she's a mother of a child with Gaucher disease type 3. And if you can imagine, she first got involved internationally, and then she started working in her country, because at first for her it was difficult to do because of the stigma. So this is why she joined internationally. But after meeting all the amazing people like we have today, it was easier for her to do more things. So Andrea, you can go now.
Thank you, Vesna. You actually put all the spoilers of my story, so if anyone doesn't have time, was nice meeting you. I'm joking. So as was mentioned, my name is Andrea. I come from Vilnius, Lithuania. We are a small country of 2.5 million people with very few Gaucher patients. Well, the foundation is good. There is an enzyme replacement therapy available. It might take time to get it. You know, for some people, they wait a year or more after they are diagnosed, but it's possible. And I always remember that we are fortunate in that regard. But the story I want to tell you today is a personal one, and maybe somewhere in it you will recognize a part of your own. So 5 years ago, I became something I never expected to be, a mother of a child with a rare disease, type 3 Gaucher disease, and it was a shocking moment, and like many parents in that moment, I did what we all do. I went on internet and searched. So I searched for information, for hope, for certainty, and for a version of future that still could make some sense, because my son was 1 year old at that time and his mutations showed both type 2 and type 3, and the doctor stated just the facts. Type 2 survives till age 2, type 3 faces chronic illness, and you as a parent discover this information when your child is 1 year old. So in my country at that time, there was no active patient organization. There was one other child type 3 patient. Apart from that, no visible community. And then I found International Gaucher Alliance. And what I found there was not just information. I found something much more powerful. It was, of course, people who understood without explanation, real people whom I could ask questions and get real life answers, and people who were living full lives, not despite the disease, but alongside it. So it was easy for me to stay in International Gaucher Alliance. I stayed at first quietly, joining webinars like this one, more listening than speaking, learning, and then slowly stepping in, first volunteering at the Guardian project. If you don't know about it, it's a project where IGA tries to collect the clinical data of type 3 patients and make a world registry of how type 3 patients are doing with the disease along their lives. And I was also taking regional manager responsibilities. And then I remember there was one moment when everything changed at the European Rare Disease Conference where I went as IGA volunteer. I was surrounded by patients, doctors, advocates, policymakers, and I felt part of something. And when IGA CEO, a person that so many admire and love, Tanya Colin Histed, encouraged me to apply for a board position at IGA. I remembered thinking, I would love to, but maybe I'm not ready. And I think that's exactly the point in many things, and especially in patient advocacy, because sometimes we feel that we're maybe not ready to step into something bigger, and yet we do. So as a board member, I went to IGA's Biennale meeting where I met not other rare disease patients, but people all over the world somehow related to Gaucher disease. And few of them are here on this meeting. And I met so many beautiful, courageous people who were at the same time patients and caregivers, very active in their local communities. And they gave me great inspiration. Continued working with IGA, helping organize International Gaucher Day, chairing GD3 Community Advisory Board. It was and it is very interesting, and it really helps me grow. But here's the part I haven't told you yet, and Vesna did in the beginning. At that time, almost no one knew about my son's diagnosis in my home country. Well, at least not publicly. Like, I was involved internationally, learning, contributing, connecting, but at home I was silent. And the reason behind that, because I was afraid that my son would be seen differently, that his diagnosis would come before his name, that people would see the disease instead of a child. And these were the feelings. And slowly something shifted through people I met, through the stories I heard, and through the quiet strength of this community. And then I realized that patient advocacy is and at the same time is not about the disease. It is about the person. It's about how we live and how we should live, or we would like to live, how we care and how we should care, how we show up in our lives for ourselves and for each other. And last year, 5 years after my son's diagnosis, I did something which was not foreseeable in the first place. I told my story and his story publicly and started a podcast where I invite people with rare diseases to share their personal stories. And when I listen to them, when I ask questions, I feel that my openness helps them to open up. We talk about how disease changes life, but also, about dreams and identities and experience. And I don't know how in your countries, but in my country, rare diseases are mostly featured through a medical lens. But I would like audience to see people behind the rare conditions. And together with my husband, we also created a charity. We support the hospital where rare disease patients are treated, and not in a way that we buy some equipment, but first of all, so the visits to the hospital would not be more of a burden as it already is. For example, simple things, to have books and toys when they do infusion, or for parents enjoy a free cup of coffee, small things. We, of course, advocate for better care because access to specialists is hard to get. And though we are a small country, but for some patients, they need to travel in one day 300 kilometers back and forth just to get an infusion. And we think that it needs to be changed. It could be changed. Someone just needs to wish for that. So we want to create change where it's needed. And I can sincerely say that my life became fuller with this. And my son, he is 6 now, He knows the words Gaucher disease. He, of course, dislikes the infusions. He manages pretty well. I'm happy that he manages pretty well with his eyes moving slower than his head. And one day, as a grown man, he will consciously understand his condition, but I hope that when that moment comes, he will see it in the way that I have learned to see it. That is just a one part of much bigger life. Because when he asks me, why do I need to go to the infusions? None of my friends do that. I also always tell him that all of us carry something. Some people wear glasses from the very beginning. Some people live with diabetes. Some grow up in single family or in a big family, and difference is not exception. Difference is what makes us humans, and hiding does not make it stronger. But accepting and sharing it can. And I think I can truly and sincerely say that I have to thank International Gaucher Alliance family for helping me understand it. And this made me more authentic. And I think when there is authenticity, then there's connection. And with the connection, there is power. And so many people in this virtual room in their speeches prove that. So yes, this is my story. Maybe yours is similar, maybe yours is different, but maybe it's also waiting to be told. And I just want to encourage you, though people in this room actually don't need to be encouraged, just use your voice to tell the story. That's it. Thank you.
Thank you, Andre. Really, thank you for finishing this with an inspirational quote for all of us. I think it's never enough to hear inspirational stories, to hear inspirational quotes. We all need to be motivated daily. Sometimes I just put, on my social media, I just choose some inspirational stuff to come up first, and then some funny stuff, so I can start the day a little bit easier, get something inspirational, get something funny, and then start working. It's much better when you hear something nice and something that will keep you going. And sometimes we all do feel like giving up and like doing nothing, because it's never easy to negotiate with governments and politicians. But what I always say, they change and we stay. We are here. We are here to stay. So, if you can't fight with them, sometimes you can just wait them out. That's a good idea too. So everybody who spoke, you have one more chance to say one sentence, so we can close the webinar. So I'm gonna start with Roselyn.
So for me, I would say just reiterate that hope is not passive, and it's action oriented. So let's put it into action. As we continue to hope for things to change, let's start by making that difference ourselves and doing something about it day by day.
Thank you, Roselyn. Dr. Imalke?
Yeah, I think I'm the only doctor who is here. What I want is a community like you guys, and our parents and families are not coming forward, and they keep hiding, and it's very difficult for them to get on board. So still, the initiative we have created is still a doctor-led thing, but I wanted to take this up by our community. So maybe in years to come, I think I'll be able to achieve that and hand over that to them, and I can take care of patients using my clinical expertise. Yeah.
Thank you for that. Yeah, and feel free to share this webinar when it's uploaded with the patients and families. Maybe something will inspire them. Why not? Andre, you can say something.
Well, I said a lot, but one thing that I didn't cover is the language that we use when we speak to a patient, to a caregiver. Let's be cautious about as a patient advocate as well. Let's be cautious about that language, because it can give hope or it can make you close. So this is entirely into our hands.
Thank you, Andra. Alexandra, now it's your turn.
Bueno,
Sorry.
yo diría de todo lo que, una frase que es motivante es que el paciente, digamos que el paciente debe tener claro de que cuando tienes un diagnóstico, cuando te dan un diagnóstico de enfermedad rara o lisosomal, el paciente lo primero que busca es a una persona, a un par que lo entienda en ese proceso, ¿no? Pudiendo ser en primera mano la familia y posteriormente la familia más grande, que es la asociación. Entonces, la asociación es un organismo clave para dar ese sostén tanto al paciente como a la familia. Yo creo que ese es el objetivo de la asociación, ¿no? Eh, mm, no se me eh, y creo que también es importante resaltar de que eh, el paciente, quiera o no, quiera o no, al pasar de los años con todo lo que vive y con todo lo que le tocará transcurrir, se volverá un paciente experto, ¿no? Y ese paciente experto finalmente puede llegar a convertirse en un defensor eh, de pacientes y de otras personas en el camino, ¿no? Digamos que eso es lo que yo resalto, ¿no?
Thank you, Alexandra. Gracias. So what all of you said, it's like really very important. And I always tell patients, yeah, I'm a patient advocate. I can talk for your needs. I can talk about your problems, but it's very different when they hear your voice. And you may think that you don't have enough knowledge or you won't tell your story the right way, but it will be more powerful than somebody else telling it. So this is why I want more patients to be empowered, to tell their stories, to talk about their problems. This is how we find solutions together. It's not about one or two people talking, it's about everybody talking. This is what we need, to be really one voice together. Thank you, everyone, for attending this webinar, and thank you to our speakers for sharing their stories. So see you at the next webinar that IGA will organize, and I hope that you will learn something from this session. Have a nice day.